Hello everyone, my name is Luis and I'm an occupational therapist. Today I'm going to break down how I do my questions, and it's very beneficial for OT students and also for OT practitioners who decided to go and switch jobs to gain competency in another areas. So I like to do this video because I think it's a great idea to show how I was preparing for my license, and in the future I can revisit this video if I want to gain competence in another areas, so I don't forget how I was breaking down this. I was doing many quizzes, so I was getting an idea of patterns, and then I realized that this is not just for doing quizzes, it's also for applying it in the OT real world, as in the job. When I see the areas I was looking, like at the beginning I was like, oh my god, I have to get a quiz and I don't know how to approach it. So I study hard and then I figure out. So then I was thinking, like, instead of figuring out everything constantly because I was exhausted, I decided to see a pattern, and then I realized that it has some areas that I have to know and to apply in general. So I'm going to read this question I just created. It's my question. And I'm going to break it down rather than read the whole question, because I assume that many people can read the question on their own and they can pause and decide what is the answer and why, and then go into the rationale or discuss with classmates or with other coworkers or mentors. I know that you can do that by yourself, so I'm going to break it down from the beginning to show you how I do. Like this, I can do all the questions because that is how I was working and making it very easy, rather than reading the whole story and believing like watching the movie. I break it down. An OTR who is working in a hospital setting. So the setting is important in all the questions. In this case, it's a hospital, so I am assuming that something is going to happen in the hospital. It's not going to be at home. Is evaluating an outpatient. So if it's evaluating a person, what I'm seeing in this case is that the person got the referral already, the OT got the referral, the OT did a screening or someone did it, and this person qualifies for further comprehensive evaluation, and it's possible that it's going to receive OT services. So we are going to do the evaluation. So in the evaluation, I'm going to consider an OT profile, observations, and selecting an assessment. And also says that it's outpatient. So if it's outpatient, it means that the person can navigate the environment and come into the clinic by themselves or with family. So someone is going to bring them. So this client has a distal radius fracture recently. It's distal radius. So the radius is in the forearm and distal is by the wrist. Maybe they fall, maybe they hit an object or something, and it's recently. Recently means that the injury is mostly less than a week. So less than a week means that in the stage of healing, maybe has wounds, maybe has the fracture is bleeding, maybe has edema, and maybe has pain. How should the OTR respond to this client? So now that I was breaking down the question, I'm thinking like, okay, it's an evaluation for a person who is outpatient, and the person has a recent fracture in the distal radius. So what I have to think is like, okay, it's an evaluation, so I'm going to do an OT profile. I'm going to discuss with the client the goals. We're going to collaborate together about the context, about the home environment, about what happened, what was doing before, what is affecting daily life with that hand. So it's something related to just evaluation without thinking too much. And then from there we can establish a goal. and then I can see the person in the same evaluation, how they are performing, and I can select an assessment. Although in this case, I think should have a immobilization based on the physician note because it's a recent injury. So the person can mobilize the arm but not that area. And maybe the person is going to need some ice during the stage of inflammation. And let's see what are the answers. So the first one, give the client a home exercise program. I agree with that. With gentle passive range of motion to allow the client to reinforce what they have learned during the OT evaluation. But, the home exercise program is great because when you are treating a patient, they cannot rely on doing just 45 minutes of therapy. It's their responsibility to keep doing their homework in order to improve faster and sooner. So the answer is great, but passive range of motion is contraindicated for a fracture because the stage of recovery in a fracture is first is going to be in immobilization during the recent or frequent, when the acute stage, and then it's going to have active range of motion gently, and then it's going to progress to isometric, and then isotonic, eccentric, and then concentric, and then they can go from there to strengthening, and then always tied to their occupation. So that is not gentle passive range of motion, is aggressive. The second is used fluidotherapy and observe how the client performs gliding exercises based on client's occupation. So it's great to put the PAMs related to the client's occupation. However, gliding exercises could be more related to a tendon injury, and this is a bone fracture. And fluidotherapy at this time is unnecessary because the client is not sensitive, and it would be better to use ice. The third one is a summary of the client unique characteristics, context, and meaningful goals. Yes, that would be great. I like that because it's something very specific and is part of an evaluation. And meaningful goals in collaboration with the OT, I would say, because sometimes patients or clients, they want to do something that they are not at their level yet, and we have to discuss, but they also have the autonomy to do what they want, but we are here to guide them to be safe. And the last one is evaluating client cognitive level that hinders or supports meaningful activities. That would be great if we are evaluating a person with TBI or who is unsafe or who has some brain injury, but this is not related to the case scenario because this person is having we are addressing the distal fracture. So that is how I do when I read the questions, and also when I think about case studies, CSTs, or even in real life. I'm going to make sure that when I read a question, I'm going to know the OT process always, because you need to know what is coming next. And if you get the habit of following the OT process in all the questions, you are going to know that this is very beneficial for real life as an OT practitioner. For the diagnosis or the diseases, it's great to know the difference. If the fracture is in the upper extremity, and we know that if it's in the shoulder, we use first passive range of motion, and if it's distally, we use first active range of motion. If we know these differences, we are going to have different approaches. We have to, when we hear the diagnosis, you know that the frame of reference is going to be biomechanical. You cannot think that it's going to be compensatory because it's not a displacement of a fixed oblique pelvis or something like that, you know that you can restore the issue. Then overall, if they say how should the OT respond to the client, is like very general, but it means like what they should do next after having this information. So I would always answer the question, because the question is something that is related to the action of the OT. Make sure that fits the OT process, make sure that the is active and not passive, and make sure that is always related to the condition. When you have the condition in mind, you have to think if it's compensatory, if it's remediation. You have to think if it's consultation, then you don't do any intervention, you just give an advice. So having these things in mind, all the questions are kind of similar. And when I was having all these areas, like if the person has aphasia, and dysphagia, we know that they are related in communication and in swallowing, but we have to see what the question is addressing. Is addressing feeding or is addressing communication? And like that is everything. For example, if they are addressing the same question and they say an OT who is working in a hospital and has a referral for this patient, so you are not going to do a summary of the unique characteristics, because you have to do a screening, because maybe the person doesn't need services for OT. So if you based everything in the OT process, and then you have in mind the frame of reference applying to the diagnosis, and you answer the question with what is initial, what is best. If you had doubts between A and B, and you think seriously what is best, if you don't know which one is best, you can act out, like doing like with kinesthetic terms. For example, it's talking about what is internal rotation, which one is more performing more internal rotation, like tying your shoes or fixing the shirt in your back. So if you don't know, what you can do is put your hands towards tying your shoes, and you can see that you have some internal rotation. Or even if you put the arm in neutral and the other arm is doing all the work, you can avoid that internal rotation. Can be neutral the arm. However, if you have to use the same arm to fix the shirt in your back, the internal rotation is deeper. So performing what they are asking gives you an idea to which one is the best answer. So that's it. Then take into consideration, you have to know when you apply PAMS, what are the contraindications, if there are precautions, what needs best, what is first, what is safe, if it's recently diagnosed, if it's a long-term goal or short-term goal, and that's it.